Laparoscopy, surgical, with radical hysterectomy, with bilateral total pelvic lymphadenectomy and para-aortic lymph node sampling, biopsy, with removal of tube, S, and ovary, S, if performed. The physician performs a laparoscopic hysterectomy, bilateral total pelvic lymphadenectomy, and para-aortic lymph node sampling, and may remove all OR portions of the fallopian tubes and ovaries. The patient is placed as the dorsal lithotomy position. After the insertion of a speculum in the vagina, the physician grasps the cervix with an instrument to manipulate the uterus during the surgery. A trocar is inserted peri-umbilically and the abdomen is insufflated with gas. Additional trocars are placed in the right and left lower quadrants. The uterus is dissected free from the bladder and surrounding tissue in its body, with the cervix is dissected from the vagina. Alternately, the vagina may also be excised. Coagulation is achieved with the aid of electrocautery instruments. Some vessels may be ligated. The uterus is morcellized and removed using endoscopic tools. One or both ovaries and/or one or both fallopian tubes are removed in similar fashion. The physician removes the pelvic lymph nodes on both sides and takes samples or biopsies of the para-aortic lymph nodes. Once the excisions are complete, the abdominal cavity is deflated and instruments and trocars removed. The fascia and skin of the abdomen and vagina are closed with sutures. Laparoscopy surgical, with vaginal hysterectomy, for uterus 250 grams or less. With removal of tube, S, and/or ovary, S. Laparoscopy, surgical, with vaginal hysterectomy, for uterus greater than 250 grams. With removal of tube, S, and/or ovary, S. Laparoscopy, surgical, with total hysterectomy, for uterus 250 grams or less. With removal of tube, S, and/or ovary, S. Laparoscopy, surgical, with total hysterectomy, for uterus greater than 250 grams. With removal of tube, S, and/or ovary, S. The physician performs surgical laparoscopy with vaginal hysterectomy for a uterus. The laparoscope is used to perform the initial operative portion of the hysterectomy. For the vaginal portion, the patient is positioned in stirrups. A trocar is inserted peri-umbilically and the abdomen is insufflated with gas. Additional trocars are placed in the right and left lower quadrants. An intra-abdominal and pelvic survey is done and any adhesions are lysed. The round ligaments are ligated and incised. Starting on the left round ligament, the vesico-uterine peritoneal fold is incised and the peritoneal vessels are dissected and desiccated. The physician continues the incision across the lower uterine segment to the round ligament on the other side and dissects the bladder off the uterus and cervix. Staples are inserted through one port on the side to be stapled, or a bipolar coagulation unit is inserted for electrocautery. At this point, if tubes and/or ovaries are to be removed, the infundibulopelvic ligament is now ligated lateral to the ovary. If not, the ligation is done medial to the ovary. Staple ligation or electrodesiccation of the uterine vasculature is accomplished on both sides, followed by that of the cardinal ligaments. An anterior colpotomy incision is made to enter the vagina and the vaginal portion of the procedure is begun. The vaginal hysterectomy proceeds through a posterior cul-de-sac incision. The uterus is removed, the vagina is closed, and hemostasis is confirmed before the trocars are removed and the skin incisions are closed. Report 58550 for removal of uterus organ, 58552 if uterus, tubes, and/or ovaries are removed. Report 58,554 if tubes and/or ovaries are also removed.